Hello everyone, welcome back to our show Healthy Ramadan. I'm Dr. Noor Al Nibari. Today we're going to pay particular attention to all the diabetics out there who want to exercise in Ramadan. Of course, there are a few tips that you need to be aware of. First of all, you need to consult your doctor before you go and do any type of exercises because some of the diabetics are dependent on insulin shots and they need to know what is the best time for them to exercise so that they don't get into the danger of developing low blood sugar during exercise. And of course, in general, the best time to exercise for you, diabetic patient, you need to do it after exercise in general. However, if your doctor says otherwise, just listen to him first. Another tip for you guys who want to exercise, you have to know why it's very important for you. It is really important for diabetics to exercise because it does control your blood sugar level, and you will actually achieve a better blood sugar in general. And usually you can achieve that within 3 months of exercise. So it is a really good point. Even if you don't lose weight, you'll still control your blood sugar. So exercise is very important for you. And as well, if you're going to exercise, you need to eat a healthy diet. So try to go to your dietitian and consult him. Make sure that you're eating enough vegetables and fruits and keep yourself hydrated, of course. So just take the month of Ramadan to develop healthy habits and healthy lifestyle. And however, don't push yourself too much. Just do something that is mild and moderate, and just make sure that you're eating enough during suhoor and eating enough during futur as well. And just check your blood sugar regularly during the daytime and also after breaking your fast. Just one last thing now. If you want to exercise, just it will help you lose weight. So it is a good chance for you to lose weight and exercise at the same time. And it's always better to consult a fitness instructor. And you have to know that he will choose the right exercises for you, especially if he has a diabetic background and he knows what he's talking about, of course. So now we have Muayyid Matar, a fitness instructor here in Dasman Diabetes Institute. And first of all, I'd like to welcome you here in our show. And happy Ramadan to you.
Happy Ramadan, Dr. Noor, and thank you to invite me here.
So it's really, you're working with diabetics, here in the gym. So tell me, how is it different training a diabetic patient than a normal patient?
Actually, they are different because the normal patients, they don't have low blood pressure or high blood pressure. They are not diabetes. The diabetes, we have to take care more about them because we have to take care about the blood sugar. If it will be come down or will go up, we have to be care to be in the middle. Actually, yeah.
We need to pay special care because they are, at risk of developing more problems during the exercise. So, what kind of problems can diabetics develop during the exercise?
Like hypoglycemia, they maybe the blood sugar, sorry, will become low. They feel dizzy. They cannot see very good. They feel that they sweating. They want drinking some water. They want something to drink, something to eat. So we quickly have to give them something to eat and something to drink.
Of course, and of course, you're trained to know and learn exactly what the diabetic need. So, in any case, have you been, able to manage a patient, or if the patient had trouble, how did you help him here in the gym?
Actually, before he starting the exercise, we take the blood pressure and the blood sugar. We'll be careful about that. If the blood pressure it's fine, he can exercise. He can exercise 30 minutes. Then we stop him for 5 minutes to take the sugar again. So then we can manage. Actually, I didn't have the case that somebody will fall or something like that because every time we take the blood sugar before, during, and after the exercise.
which is extremely important. Like it's very amazing that you're fully equipped to get if there is in case of emergency.
We have
Exactly, and it's a good thing that if you're a diabetic, you have to go to a gym that is well prepared for any emergency. And thank God that didn't happen to
Thank
you,
you.
because of it, I'm sure it's going to be stressful.
Yeah, of course.
Yes, of course. So for diabetic patients, I'm sure you're going to choose exercises that are more suitable for them.
Yeah.
So in general, what are the exercises that diabetic patients can do in general, even after Ramadan?
After Ramadan or during Ramadan, we prefer actually to do some cardio exercise, 20 to 30 minutes. Then, as I told you before, we have to take the sugar for them. If it's fine, we can continue a resistance exercise for them to make the muscles strong and to make also the blood sugar in the how can I say that? It's to control, yeah, to control the blood sugar.
So what do you mean exactly by, strengthening exercises or resistance exercises? What do you mean by this?
Um, I mean that it's the different on the cardio exercise. The resistance, it's mean each muscle will train by itself. So each machine, what we have, it's for separate muscles. That's why we can take care about how the muscle look like. That's why we can make the difference between the cardio. Cardio, it's make just all the body. It's for whole the body. The cardio exercise for the heart. But the resistance, it's for the muscles. So they have to do the exercise for the heart and resistance for the muscles.
So how often do you recommend cardio exercise and the resistance exercise?
Actually, we recommend our patients to come 3 to 5 times per week or in the week. Sorry. So they have to come every day or three days. When they will come, they have to do cardio and resistance both together. Sometimes they have to go to the pool to do some aerobics in the pool.
Okay, so I'm sure that there are specific exercises for women and men. So what is the difference exactly between these two groups?
Uh, Actually, the women and the men. It's very hard question because I take care about the men and the women take care about the women. So I don't train the women actually.
Exactly. So it's you're specialized in men
Yeah, in the
exercises,
men
which is
exercise.
important.
Yeah.
So in general, you said that also cardio exercises are important. So what kind of cardio exercises would you recommend for them?
It depends because if the patient has sometimes not only diabetes, they have sometimes problems with the knees, with the joints. So we prefer to do the bicycle with the back support. But if they don't have any problem, we recommend to do the treadmill or the elliptical.
So what is the best time to exercise in Ramadan now?
During Ramadan, we prefer our patients to exercise after futur. But if they insist, they can exercise 2 hours before iftar. Because we worry about the blood sugar. If will become down, then he can go to his house and or to her house and eat iftar with the family. So I prefer them to come after iftar, or if they insist, as I told you, they can come 2 hours before iftar.
So if they're coming before iftar, what do you do exactly for them? Are you going to pay special attention, or is there something that they have to do?
The attention we give all the same, but if they come before iftar, we have to take care that the exercise should be light, not so strong. Like for example, only 20 minutes on the treadmill, the resistance machine, only 2 machines, like with very light weights. Then we'll send them home. Uh, of course, it depends about the blood sugar before they start exercise.
Absolutely, and you have to always ask your doctor before you just do the exercises. I think it's really important.
Yeah.
Now you mentioned something about the timing. Okay, so what about the general health, like about food and hydration? What advice can you give our viewers out there?
Of course, my advice is on suhoor. They have to eat the food with vitamins, a lot of vitamins and fibers, like oats. It's very good with milk in the morning and suhoor, sorry, with some fruits. Um, they have to drink a lot of water. Um, and this is what this is what they have to eat in the
Yeah,
suhoor.
absolutely. I totally agree. They have to take care of what they're eating.
Yeah.
And oats, as you said, it's a really good choice because it's full of fibers and it gives you a lot of energy and it's one of the complex carbohydrates that they do need. And just just a question about what should a patient do before they come here to exercise? Do they have to do anything like blood tests or see the doctor? What should they do?
Actually, they have to come normally. We will take care about the blood sugar. If the blood sugar it's fine, they have to exercise. They don't have to see the doctor or to do some blood test. No, no, they have to come already here to the gym because they will come every day if they want. So it's not necessary to see the doctor every day or to make the blood. Yeah, you know. So we take care about the blood sugar. We take for them the blood sugar. If it's fine, they have to exercise.
That's really good. So it's very amazing that you're paying a special care for those diabetic patients, and you're doing an amazing job.
Thank you.
So, what other advice can you give the people who are going to exercise, especially post-exercise? What advice do you want to give them?
Advice I have to give them that they have in the morning to make the blood sugar test in the house in the home. So they have to know that if they eat so well and they're so good, they if I can come to exercise or not. Everything they have to decide about the food, blood sugar before they will in the morning before sleeping. Also, they have to take the blood sugar. If it's less than 5, then they have to drink some juice or something until the suhoor will come.
So, after exercise, I'm sure there are stretches that everybody should do.
Yeah, sure.
So, can you tell me why is it so important to do stretches?
Stretching it's good for to release the muscles to because when you will do exercise, the muscle will be um, like tough, yeah, tense. So the stretching it will make the muscle flexible. Then the muscle will be actually not hurting the patients after when he finished exercise.
Absolutely. And I think because after exercise, probably there is lactic acid building up in your muscles. And it's a good way of just detoxifying those muscles and releasing them by stretching. And if you don't stretch properly, what will happen?
Oh my God! If not properly, that's mean that you do nothing. Just the muscles will become like next time stiff, and next you will feel the pain after the exercise.
And trust me, you don't want to feel the pain.
No, it's not about that 1 hour or 2 hours after the exercise. No, next day you will feel it. Yeah, the next morning.
So it's very essential to do the stretching. And how long should stretching last?
Actually, it's not take too much. It's just 2 to 5 minutes. So yeah, they don't have to excuse that. Oh, I don't have time. I have to go home. No, they have to do stretching. It's just 2 to 5 minutes. Actually, we will do it later, I believe. So it's just 2 to 5 minutes stretching for the muscles.
Exactly. Thank you so much, Mu'ayyid. And of course, he's going to demonstrate for us few stretches so that you can do them at home as well. But you should do them after your exercise. So thank you so much.
Thank you, Dr. Noor. Thank you. Hello everyone. Today we'll do some stretching starting with the neck. First of all, I put my hand, the right hand on the left ear. And for 5 seconds. The other side. Stretching the neck. Now we will stretch the chest. And the back. Stop the biceps or the arm. other hand. Now the triceps behind head and pull. The other hand, left, right, pull the left. Now we will do the lower. Now the quadriceps, the legs, starting quadriceps. The back will be straight. And 5 seconds. Other leg. Seconds. Now the hamstring. We put my legs and the hips, front, side, 5 seconds. Left leg, hips, this muscle. Okay. The calf. For 5 seconds, 2, and left side. Hello everyone, we will continue stretching. We will do for the hamstring. We will lie down, bending the knees. I will catch the knee and pull the stomach for 5 seconds. If you can straighten the other leg. It will be better. And the other leg, right, this, and stretch, pull to your stomach. Okay. You will push also the gluteus for 5 seconds. Other leg and push. For the back also, and for calf for 5 seconds.